whatever diagnosis you're making, there should not be any abbreviations. You should be written clearly. And then supplementary records can be mentioned, like autopsy records, discharge notes, etc. So the one functionality in Argus that is difficult is there is no other place to write the reports of records, whatever you are doing. Say, for example, like ECG findings, or if autopsy was done, what was happening, what was those records, or what was there in the discharge notes. And if MRI or CT scan was done, what was the report in that. That cannot be attached in Argus anywhere. So you have to write all the details of the records, what has been in the source document in narrative writing. Okay. And then time to event onset can be in time units. Okay. That is what we are doing in narrative writing is you have given a drug and the subject has had an adverse event, and the whole narrative is working on what happened to that event. Why? Because when we are performing all the assessments, we just want to know whether the drug what we have given has caused that event or not. This is the basis of all the assessments. We are not we in along with that we will take into consideration that what are the signs and symptoms the subject is having other than the adverse event. Okay, that helps to perform that medical assessment. But always you have to keep in mind that that event what has happened, the details of all that event has to be captured clearly. Conflicting information from different sources should be mentioned and sources identified. Sometimes if there are any errors, if you feel like any grammatical errors or any informations that is not in alignment, or if you feel that there is some disparity, you have to be discussed and identified. You should not take your own decision to write to correct that information. Okay. Say for example, like when you are writing this safety narratives, you find that in one place there is HYPTEN instead of hypotension. If an O is missing, you should not come to a conclusion based on the details what it is given and convert it to hypotension, because it can be hypo or hypertension, or it can be exactly some other things what might have happened. So what you should not do is you should not interpret and manipulate and convert that detail into a relevant clinical information that might alter the exact scenario what has happened to the patient with the investigator. So this you have to keep in mind. Okay. So whatever you're writing, whatever is in the source document, you exactly capture what it is written. Don't try to interpret, don't try to manipulate, or don't try to analyze and come to your own conclusion, because this are going to impair the quality of safety narrative what you're writing. Okay. Then judgmental comments should be avoided due to legal implications, because sometimes because of overdose this has happened like that. You should not give any conclusive statements or any judgmental comments, because the same reason is we are not on the bedside of the patient and we are not exactly seeing what has happened to that patient. We have received that source document data, and from that we are trying to draft a safety narrative. So in this case, if there is any overdose or medication error that is mentioned there, when you are writing a safety narrative, keep in mind that you should not write any judgmental comments, because that might lead to legal implications for yourself and also to your company where you are working. Okay. Narratives should aid in the overall medical assessment of the case report and benefit risk assessments if applicable. Why you are writing a narrative in this analysis tab is the purpose is mainly to perform the medical assessment like seriousness, expectedness, and causality assessments, and how the medical reviewer or a physician is going to make this assessment is mainly based on the narrative, because you are concising the source document and you are giving clear clinical and lab informations that are going to help them to perform that assessment.